When you have a company name like Rad AI, it puts a lot of pressure on you to deliver radical AI innovations. After all, it's in your name, right? So when I saw them at RSNA 25, I jumped at the chance to speak with one of their executives about where they believe AI can have the most impact in healthcare. Joining me on camera is Demetri Giannikopoulos. He's the Chief Innovation Officer at Rad AI. Let's get to it. Demetri, welcome to the program.
Thank you, Colin. Looking forward to it.
Yeah, I'm excited to be here with you, but before we start and dive in deep, can you tell our audience a little bit about you and Rad AI?
Sure. I'm Demetri Giannikopoulos, the Chief Innovation Officer at Rad AI. Been in the industry for about 20 years now, seeing the growth from literally telephones to modern artificial intelligence in radiology. It's been amazing over that couple decade period. Rad AI was the first generative AI use case in healthcare. We started as a company back in 2018. We rolled out our impression generation, which is the bottom third of the radiology report, where it's really synthesizing the important points from above in 2019. Long before it was called Gen AI, but it was a tool that radiologists just absolutely loved. And since then, we've gained over 50% market share. 9,000 radiologists leveraging us on a consistent basis. So a lot of very great feedback from the community.
Now, with a name like Rad AI, I've been looking forward to asking you this question all day because where is AI most useful, in your opinion, in radiology?
I think the name shows my bias.
Okay.
And the focus as well. So radiology, I think, is one of the most impactful areas for artificial intelligence in healthcare, period. Partly because there is a massive staffing crisis. If you look at the number of radiologists graduating, the number retiring, or frankly just quitting, due to the, constant grind of increasing studies, the crisis is growing, and as is the disparity. So when a radiologist is working in their environment, the way that they interact with the patient is by looking at the images and using their voice ultimately to determine what's going on. So they interact with the patient that way, and ultimately their product is the radiology report. So it's a very impactful piece of healthcare because if you think about it, the like CT scans and X-ray scans, they're almost the stethoscope of the 1900s. Like it's the way that you'd see inside a patient's body, understand what's going on. Now, what AI offers is the opportunity for radiologists to be even more efficient, even more engaged with their patient, have better context of what's relevant for the specific case that they're reading, not just in the radiology context, but ultimately in the care context. So, how does the ordering provider receive that information? How does the referring provider receive that information? Also, nowadays, how does the patient receive it?
Well, I like what you said there, Dimitri, because I've heard it said that radiology is often the gateway to treatment. I mean,
Yep.
you can't get treated until you had those scans. You can't get treated until the report is read by the physicians, and then from there, the treatment plan can then be formulated.
Agreed. Yep.
So, tell me a little bit about some of the stuff you're doing here. What are some of the major announcements that you're making here?
So two major announcements at RSNA 2025. One is our multi-model speech engine. So what we've actually done is implement multiple models, so multiple AI-based speech recognition engines behind the scenes for the radiologist that can look and determine what's being said. And why that's important is, one model is going to be good at dates, another one's going to be good at numbers and measurements, another one will be great and fine-tuned for radiology terminology. So we can leverage all those, and this can happen transparently to the radiologist. Now that we're using like cloud-based inferencing and all that kind of stuff at significant speed, and ultimately show efficiencies of 5 to 10% in their dictation process because they're getting even better results, and also better understanding. So a good example is a common phrase is no evidence of neoplasm. And that's a very pertinent negative because the patient's being worked up for cancer. You need to figure out, is there evidence of cancer in that situation? No is one of the easiest words to miss because it's a small word utterance. Speech recognition has always struggled with those small words, and building that full context, building that understanding, lets us identify that what they didn't say evidence of neoplasm. No radiologist would say that. They would describe the neoplasm. Uh, they most likely said no evidence of neoplasm. Put that into the radiologist's view, flag it for their review so that they understand they're like, hey, there was maybe some mild discrepancy here with our quality checker, which is a separate agent, and then ultimately have that report be fine-tuned the right way for the radiologist in their voice.
So having all these multiple AIs, does that give the radiologists, or do you feel that this is giving the radiologists more confidence in AI because it's, you've got the ones that are specialized in picking up the different aspects of the report they're dictating?
Absolutely. So like they look at it, and speech recognition is not new. It's been around since the 90s, probably even farther back than that. But they look at this as the next generation of not just recognition but understanding. So being able to engage in that way. The other key piece that really builds confidence in artificial intelligence is our partnership with RSNA Ventures. RSNA Ventures is a wholly owned subsidiary of RSNA. It's the first time that they're ever forming commercial relationships. We are their first commercial partner.
Oh, okay.
And the reason they selected us is because we have such a powerful way to engage with the radiologist at the point of care. So as they're dictating, as they mention that there's a focal nodular hyperplasia, it can bring up information, not just any information, but RSNA information about that FNH. So it actually shows them the differentials that they need to see. It structures it into like benign HCC presentations, all these different medical terms, but really puts that at the point of care so the radiologist can access it instead of going to Google or one of the large language models that are out there to try and find this kind of information and have to wade through it. The other really key thing that it does is it puts a citation in the report for the ordering physician. Because again, like they're the gateway to care, right? So the radiologist being able to tell, the ED provider or the oncologist that ordered the study, this is what I was looking at from RSNA as I was going through and making my determination on on the hyperplasia in that example is really powerful. It's clickable links and ways to interact.
Demetri, when you look out at the horizon of where AI may be taking us next year, I won't ask you for more than a year, but where do you think AI is going to be a year from now?
So, I mean, if you go around the show, AI is everywhere. Like, I know there's a RSNA AI showcase right behind us, but realistically, it's embedded in every single
Sure thing.
solution. With that comes a bit of like, um, I call it like beep beep, and boom boom, like all those different things where it's like almost too much interaction. Like, they're getting the result from this model, that model. They have a foundation model that detects 250 conditions. All those different things. How do they sift through that and ultimately make any sense of it? And that's where our reporting solution is the most logical area of interaction for them to really understand what's going on. So we can take all this noise from all these other, solutions, all these other places, figure out what's relevant in the context of that patient. So we have AI-based patient summaries. We know they have a prior history of cancer, and based on that, maybe some of those findings aren't relevant. So the radiologist doesn't get bogged down trying to review that stuff. Still flag, let them have awareness, but ultimately enable them to use their voice interacting and make the diagnosis in their voice in their report, which then gets delivered to the patient.
Demetri, you shared a lot of great information with us. Where can people go to learn more about Rad AI?
Well, radai.com is a great place. Obviously, this interview is a start, but if you go to our website, you're able to get in contact with us, ask additional questions.
Amazing. Well, Demetri, thank you so much for being on our program today. Really appreciate it.
Excellent. Thank you. Appreciate it.
Hey, I really enjoyed that brief conversation with Demetri. I loved how he talked about AI tools in radiology not only needing to be functional and deliver value, but also having to engender trust. And without that trust, clinicians won't adopt those tools. I'm looking forward to catching up with Demetri and Rad AI again down the road. And hey, if you made it this far in the video, we'd really appreciate it if you mash that like button and click subscribe. Also, head over to healthcareittoday.com where you will find more great content like this. I'm Colin Hung. Thanks for watching, and I'll catch you on the next video.